Hi, good evening, everyone. I am Dr. Satish, working as a consultant at Emergency Department, Yashoda Hospital, Secunderabad. Every Friday, Department of Emergency Medicine, Yashoda Hospitals bring forth a new interesting topic in a webinar. And today, I invite everyone to this webinar on a topic: rabies post-exposure prophylaxis in emergency department. Animal bite is a very common condition we come across in our EDs every day. So let it be a dog bite or snake bite or any bite by animal by and wild animals. Okay. And most common in cities these days, we see dog bites, very common. People going for morning walk or children coming from the schools. So these kind of bites are commonly encountered and we see commonly in our emergency department. So today we have with us Dr. Kumar Raj, who is a consultant and head of the department at emergency department at ILS Hospital, Kolkata. He is also semi-president, West Bengal chapter, and also an NABH assessor. I welcome Dr. Kumar Raja to take over the presentation on rabies post-exposure prophylaxis in emergency department. Over to Dr. Raj.
Thanks a lot, Dr. Satish, and it's always pleasure to be with SEMI and always wanted to contribute a part of me. And thanks, Dr. Saujanya and the team for giving me this opportunity. So let's come to this topic, especially in the part of the India which I'm practicing. So rabies is managing rabies, managing a rabic animal bite has always been a challenge. I've been working through this rabies society here from the West Bengal. I'm also one of the most active member here. And my hospital is definitely one of the rabic center, which I'm doing a rabic OPD, which is there in this area. It's only one there. So I can understand, and we all know that rabies is something which is a most important and if it is and particular treatment we don't particular approaches that we don't do for these rabic animal bite, then definitely it is something which will end up losing patient and the incubation periods is totally unpredictable. So we'll try to move to the slide and concentrate more on the emergency part. So as we know, it's a dangerous zoonotic bite by Lyssa virus typho is one of the oldest disease which is known to the mankind. And the worst part of this, there's 100% fatality rate. Worldwide, there is 59,000 deaths and almost 3.7 million daily the life is lost per year. So you can understand the severity of the disease is so high. Sorry. So as we know, rabies is an acute progressive encephalomyelitis. The case of to fatality rate is the highest to any infectious disease all over the world. It's one of the most oldest described disease. And definitely it's a leading viral of zoonosis as regard as a global public health significance. We're going to go with the structure fast. It's a bullet shape enveloped virus, belongs to this Rhabdovidae family and Lysavera family. Okay, let's concentrate on the highest highest number of sorry. So there's more than 70,000 deaths we find in this part in India. At least 1 to 1.5 million people is reported to receive this post-exposure annually, and dogs constitute nearly 96% of source of infection to the human being. Around 25 million, more than that, in fact, street dogs are there in India. So, but this is something which is very exception. It's reported all area except Andaman, Nicobar and Lakshadweep Island because it's an island. So, prevalence of these diseases is not been reported from these areas. Common modes of transmission, definitely animal bites, dogs, cats, monkey, horses, sheep, and goat, and lick. It can be a lick, which just can be a scratch or can be through a bite. And rarest mode is through aerosol and through human, man to man. And most animal bite that we concentrate here, which is very commonly, is dogs and cats. So Frequently in India, dogs and cats are the major source of animal who carries rabies. So sometimes you will find in horses, foxes, cows and buffaloes, donkey, pig and sheep, but it is very, very rarely reported. So occasionally you will find in camels, mongoose, jackals, bears and other animals. So the incubation commonly 3 weeks to 3 months. Even we have noted a case between 10 to 15 days the patient has developed symptoms after a bite from a rabic dog. And imagine it ranges up to 4 years also. It can develop as early as 4 days and it can even develop after 4 years. This symptoms is so vulnerable and very difficult to understand when the patient will develop the symptoms. Bites on the head, definitely more it goes to the brain, the faster is the incubation period. Bites in the extremities will take up to 3 months. Bite with the head and the face can incubation can be up to 1 month also. So same thing. There's a multiplication locally. Peripheral nerves are attached. Then dorsal root ganglion, spinal cord, and then it affects the CNS. So as it happens, a rabic animal victim, there is a bite. A virus grows in the muscle tissue in the area of the bite, and slowly the virus infect the sensory and motor nerves serving the infected area, and then later the virus travels to the peripheral nerve to the central nervous system, as we explained. So virus migrates through the central nervous system, arriving at the brain, and virus is conducted by the nerves to the salivary gland where it grows and then it sheds in saliva. So this is a mechanism how this saliva gets infected, and whenever it touches the mucus, the open skin of human, so the infection gets transmitted. So minimal pathology is like there will be a gross brain is edematous, congested, histopathologically find this perivascular cuffing, liosis, minimal neuron damage, presence of negri body. But again, you get all these symptoms when the patient dies. Species negri bodies is find as a post-mortem finding in rabies. So nothing can be diagnosed to understand whether the patient is developing rabies or not, apart from the symptoms. So again, the same theory here. They're concentrating more on this microbiology part, where there's an eosinophilic mass where the virus free and fine fibril matrix found mostly frequently in the pyramidal cell and also found in the cell of the medulla and in neurons of the salivary gland, tongue and other organs. So this is important. The clinical manifestation, which is more in human, the furious type, out of 80%, there will be there's two types. One is a furious type and one is a paralytic type. So they both have the same, and survival is always limited. The furious type, there will be a tingling and numbness sensation at the site of the bite. There will be non-specific symptoms for both fever and malaise. Hydrophobia is more in the furious type, and aerophobia. Paralytic will have an ascending paralysis, and photophobia is there in furious type. Paralytic type will find coma. Furious type will kill you early, 3 to 5 days, but paralytic types will hardly take 7 to 21 days to kill. So anyways, this can be the different type of presentation, but the survival is always questioned in both of the presentation. So what is the WHO classification of rabies exposure? So for the convenience in providing better treatment, WHO has categorized animal bite into 3 categories. Okay, so now start what is category 1. So the nature of exposure. Imagine a dog, even if licks a intact skin, a healthy skin without any open wound. And if the document just touches the skin, not the open wound. So that also is been taken as a category 1 bite. But category 1 bite treatment, if reliable case history is available. So basically, when they're saying treatment is no, I will not totally agree on this. Basically, when you get this kind of lick, soap water is the most important part. You should wash it very thoroughly. Nowadays, it's very common that our pet dogs comes and licks the whole of our body. But sometimes if the dog, even if the dog is vaccinated, and if you're not sure about the vaccinated status, still it comes to the same criteria. But sometimes if it's your pet dog, you know the condition of the dog, you know the dog doesn't go outside. So sometimes it has been taken very casually, but it has been reported history, even the pet dog carrying a rabies virus from outside and then spreading to the family members. So need to be very careful. So category 2 bite. So nature of exposure, nibbling of uncovered skin, lick on broken skin, superficial scratch that does not break the skin. So imagine a dog bites, when we are wearing a jeans or a pant, there is a dog bite, but the blood doesn't come out and the skin integrity is not lost, the skin doesn't breaks, then it can be taken as category 2 bite. But again, the line of recognition is very less, because when you see practically, imagine if there is a dog bite, maybe it is biting on the leg above the pants, and later you don't realize whether it's bleeding or not, and the patient comes after 24 hours, or maybe he has been bitten by a dog last night and he understood there is no breach in the membrane, but maybe there is, but he didn't understood because it was very mild, and next day morning when he comes, then you don't have anything over there to understand whether there is a bite or not. So sometimes it is very vulnerable. So what I mean to say, even if it is a category 2 bite, and if there is even any certainty of a breaking of the skin, even if it's not visualized properly, basically it has to be taken as category 3 bite. And one more difference between category 2 and category 3 bite, if there is a dog bite and you're not able to understand whether the blood has come or not, I mean the skin has broken or not, basically we use a spirit cotton. If there is a tingling sensation in the area of the scratch or a bite without any visible skin break, and still it has to be taken as category 3 bite and to be treated accordingly. So let's come back to category 2 bite. Whenever there is a category 2 bite, the first thing what we should do, you take a tap water, forceful water, and wash it for 10 minutes with soap and water. So that is the first line of treatment, and that will, even if there is an entry of the virus, almost 99% of the virus dies there, I mean, cleans off there only. And the treatment goes with an administration of the rabies vaccine. The only rabies vaccine is required if there is a confirmed category 2 bite. Now, category 3 bite. Category 3 bite, the nature of exposure, definitely where there is a proper bite with these are the multiple transdermal bites, scratches, penetrates skin when there is a dog bite or a cat scratch or any rabic animal bite when the skin is exposed. Even there is even if they're licking over the mucous membrane, it has to be taken as category 3 bite. Again, the treatment goes in the similar way. You have to make sure the soap and water is, the wound is washed thoroughly with soap and water, and then later you have to give two things: administration of immunoglobulin. Rabies immunoglobulin is the most important part that we need to filter at the site of the bite. Basically, it is not that simple infiltrating rabies immunoglobulin, because you need to have an expertise in this. It is just not a normal infiltration. It's an infiltration which actually has to cover the area of the bite, not only the point of the bite, even the area around the bite should be covered, should be infiltrated properly. The needle has to be kept in the 30-degree to a 45-degree angle, and it should go beneath the bite or the injury. And in the case of, by withdrawing this needle, we need to infiltrate the area. And in order to understand whether the infiltration is adequate or not, we'll end up finding that even while we infiltrate out, while we take out while infiltrating, this vaccine should basically come out of the skin by you can find the oozing of the skin or the swelling of the skin, and then you find the vaccine is coming out, then you'll understand the infiltration is proper. So generally what I do is, whenever I infiltrate, imagine if 5 ml is required, I'll tell you the dose exactly in the later slides. I take 5.5 ml, and we know, make sure it is at least not less, but maybe even if it is more, doesn't matter, but should not be a less one, because if the infiltration is not proper and if the animal stays as rabic, then definitely this is a big chance of a treatment failure. So focusing on management. So here we go. The rabies post-exposure treatment in emergency. Wound should be treated immediately. Vaccine and the serum therapy when required for later instituted as possible. Initiation of the treatment should not wait the results of laboratory diagnosis or be delayed by a dog observation when rabies is suspected. Generally, when there is a rabic bite from a dog or a cat or any animal, they suspect that a rabic dog or a cat will not survive more than 8 to 10 days. So generally, there's one more concept to observe the dog, whether the dog is, if there is a dog bite and a dog surviving for more than 10 days, that we can assume that the dog is not rabic. But definitely, if there is a stray dog bite, it is very difficult to monitor where the dog went. And even if it's a dog bite at home, and if the dog dies after 10 days or 7 days, at the end of the day, already the rabies infection is there. So there's no question of taking chances and the observation of the dog. Pregnancy and infancy, most important things people keep asking a pregnant lady and a very small child or an infant who has a rabies or exposure of the rabies bite. So there is never a contraindication with the post-exposure treatment. Person who present for evaluation and treatment even months after being bitten should be dealt in the same manner as if the contact occurred recently. So these are the point again. It's very important in order when we see these patients in emergencies, and definitely we know deal with your questions also later. So wound treatment, as I said, the principle of treatment starts in two ways. One is a wound treatment, one is an anti-rabies immunization. Active immunization, administration of the anti-rabies vaccine, and passive immunization is an administration of rabies immunoglobulin. So that is in category 3 exposure. So wound treatment, rabies vaccine, and rabies immunoglobulin are the rabies post-exposure prophylaxis. So local treatment, as I kept on saying, wash the wound with soap and water, running water for 10 minutes, and you can apply any betadine or vocadine solution for 70% or 70% alcohol around the bite after you finish the washing. First step, local and immediately in thorough wash of all bite with soap and water. As I said, irrigate the virucide agent such as iodine solution, tetanus prophylaxis, and measure to control the bacterial infection that is not related to rabies, but tetanus is something that you need to give to any of the exposed wound. And suturing of the wound. Now, this is a very important part. Suturing should always be avoided, but until unless you can imagine if there is a massive bleeding or maybe there is a great exposure of the skin. So basically, we just approximate the wound, but we don't actually do a suture or some kind of definitive surgery. We always leave for a secondary sutures. But again, before we suture, we make sure there is a proper infiltration of rabies immunoglobulin. In severe wound, minimum sutures could be done, but only after RIG infiltration. So, points to remember. Now, vaccine. Wait. So, day 0, that is the day 1 of the first vaccine to be given, not on the day of the bite. When we imagine there is a dog bite 2 days back, that day 0 comes on the day when the first dose of vaccine is taken, not from the day when the dog has bitten. All modern anti-rabies vaccines are equally effective and safe. Never inject vaccine in the gluteal region. Most important, deltoid is your region where is a place where you need to inject a vaccine. Interchange of vaccine acceptable in a special circumstance, but not to be done routinely. So we make sure the vaccine doesn't interchanges, and the same vaccine that is given on the day 0 should be given on the day 5. The dose I'm gonna explain you again. Reconstitution of we need to reconstitute the vaccine and to be immediately given. We cannot keep it in the fridge or keep it up and keep it for later use. Vaccine doses is same for all group. Most important, doesn't matter you are a kid or maybe you're managing an infant or you're managing an elderly or we're managing a diabetic patient. The vaccine doses is for all same for all the group. So classification of rabies vaccine, there are the different vaccine which has been which is there in the market. There's some first there was nerve tissue vaccines, then they've come as a purified duck embryo vaccines, then you have a chick embryo vaccines, the virus cell vaccine, the liquid human diploid cell vaccine. So there are many which is available. So now here we go with the vaccine dose. Anti-rabies vaccine schedule. There's 5 doses intramuscularly to be given on day 0 first dose, day 3 second dose, day 7 third dose, day 14 fourth dose, and day 5th there is an 8th dose, a 5th dose, sorry. So the site of injection should be deltoid in arm and anterolateral thigh. Generally adult prefer deltoid. So, and what also is to be done, imagine if once we are giving in the right deltoid on the 0 days, then on the 3rd day try to prefer the left one. So make it an alternate deltoid muscles while we give vaccine in the next 5 days. So it is always convenient when we make it in alternate right and left. So never inject the in gluteus muscle, as we know, because there is a fat deposition which could delay absorption of vaccine and slowly hence and slow the antibody protection. Okay. In category 3 bite, RIG immunoglobulin on the first day to be infiltrated. Whenever you find when there is a category 3 bite, the first, before we vaccine, before we do anything, we need to wash the wound immediately with soap and water as explained, and straight away we need to infiltrate RIG around the wound. So in case RIG is unavailable, so this is important. If the RIG is unavailable to a place where it's not there, in that case, we need to give 2 doses of vaccine on day 0 and is a next best alternative. So here they say, imagine to a place where RIG is not available. So it is recommended that on day 0, that the first time when they come for it, you give 2 vaccines, right and left. That can be the best alternative, but again, it's an alternative, not the exact recommendation what is there as RIG. So we have different vaccines. Okay. We have different immunoglobulin here. One is a human rabies immunoglobulin, that is HRIG. The dose is 20 international unit per kg body weight. And there is an equina rabies immunoglobulin, that is ERIG, that is 40 international unit per kg body weight. Now, 2 other has come. One is your monoclonal antibody. This monoclonal antibody is recently, they have from past 3 to 4 to 5 years, they have developed the doses. It has come in the market as the name of Rabies. Okay, the dose is around 3.33 international unit per kg. And now after this monoclonal, they have called a dual clonal, which is now available in the market as a twin Rab, and the dose again is the 40 international unit per kg. So basically, the 4 vaccines, 4 immunoglobulins are available here in India. One is HRIG, other is ERIG, the third one is monoclonal, and the fourth one is dual clonal. So, re-exposure after a full course of documented pre and post exposure vaccine for the modern dose. Imagine the patient is vaccinated, and again after again there is a dog bite. Mostly we generally wait for 6 months after the full vaccination. But again, if there is a dog bite or any rabic bite, then you need to give only 2 doses. That is on 0 days, 0 dose, day 0 and day 3. So no RIG is required even if a rebite of category 3. So once RIG is given, it need not to be given ever. Whenever there is a bite again from a rabic animal, go for only 2 doses after you finish after the first proper dose of vaccination and RIG. All incomplete vaccination, partial vaccination or doubtful vaccination needs to be treated as a fresh cases. So doubling of the vaccine on day 0. Most important that we spoke in patient who attended for treatment delay after 48 hours or more. If the patient comes after 48 hours or more, then double the vaccine is recommendation. In patient with where RIG is not available, which we already explained about it. In patient with underlying chronic disease, an immunocompromised patient, the liver cirrhosis patient who are congenitally immunodeficient and suffering from AIDS, as I say, HIV positive, immunosuppressive drugs or immunocompromised patient, and severely malnourished patient, then definitely the doubling of the dose of the vaccine, which is recommended on day 0. And one more thing, there's one thing that has not been in the slide. These patients, the immunocompromised patient, even if they come with category 2 bite, you please treat as a category 3 bite. So that is one of the things. Category 2 bite in an immunocompromised, malnourished, or a patient with a chronic disease, it is always recommended to start to treat the category 2 as a category 3 bite. And any doubt with category 2 bite, don't think you infiltrate RIG, you treat as a category 3 bite. And there is also a recommendation of an intradermal injection, which they give 0.1 ml on bilateral deltoid. That is, 4 dose has been recommended 0, 3, 7, and one is on 28 days. And again, this intradermal injection is as effective as IM, but the dose amount of the injection is used is very less, so that can also be done. But again, in immunocompromised patient or a congenital immunodeficient patient, we generally don't give intradermal injection. So the major recommendation is of intramuscular only that we explained. So sign of the rabies cat during 10 days of period. What are the things that you will see? What are things that you will see in the dog or a cat who has bitten a dog, whether it's a rabies or not? Any change in behavior, like being aggressive or too much of depressed, running aimlessly, attacking others without any provocation, becomes too drowsy and withdraws itself to a corner, excessive salivation, most important part. There's a change over the barking voice of the dog will change. Refusal to feed or eat unusual object like and eats unusual object like stones, paper. You'll understand there's something wrong with the animal, and even the death of the animal is definitely significant. Basically, only a rabies dog or a rabies cat. Basically, a rabies dog or rabies cat, if bites or scratches, then only basically you get the rabies. But very difficult to understand which dog is rabies or not. But definitely, when you see and observe that dog properly, you will understand there's something wrong with the animal. So, anyways, there's no question of taking risk, because many patient who comes to emergency saying that ki ghar ka dog has bitten, pet dog, is vaccine is required or not? Okay, this is a very common question. But in as per the emergency thing is concerned, we need to have zero literacy when we're managing a rabies animal bite. We need to say that we need to follow the protocol. We need to manage as per the category 1, 2, or 3, whatever it comes through. Generally, it come with category 3 only, most of them, or maybe category 2. So you need to stick to the protocol. They might show you a paper of vaccine the dog has been vaccinated, but definitely the antibody of that animal is not checked. We never know the genuine vaccine has been infiltrated or not. What is the titer of the vaccine inside the dog? We don't have time, we don't have brains also to find out how much they have, and we cannot wait also for so long. So there's every explanation goes to the same area that rabies is the end disease. Once it gets to there is no treatment. So basically you follow the same protocol. But if somehow if they agree, if they disagree to you, no, I don't want to take, definitely take a consent, because it can come to a medical legal aspect also. Because if you don't give a proper vaccine or a proper infiltration or RIG if required, then definitely the medical legal part is something that we need to take care of. So documentation, as we know, is the most important part. Even if you refuse, you document. So now, cause of the treatment failure, very important part. So imagine as we're doing it, Emma, this is the bite, and very difficult to infiltrate these kind of bite. And imagine the weight. You have to give some 6 to 7 ml in this area. What to do? Okay, so generally, we, as I always said, in the wound, around the wound, beneath the wound. So make sure the infiltration is properly. Okay, so there is an insufficient wound treatment will definitely cause a treatment failure. So even if you're putting a RIG, but if you're not infiltrating properly, so definitely it's a failure. So unless if it is not infiltrated properly, there's no point giving RIG if the infiltration is not properly. And uh, sometimes there's a non-administration of RIG which can cause treatment failure. Incomplete infiltration, as I discussed, can cause treatment failure. If somebody gives RIG intramuscularly, not around the wound, it is a treatment failure. Delay in starting an incomplete treatment means you start the treatment delay. The patient comes with you with after maybe 10 days, 15 days of dog bite or a rabies animal bite, and then you start, definitely there's a high chance that is already developed those antibodies inside, and now antigens inside has already entered. So, and definitely incomplete treatment. Intragluteal injection of cell culture vaccine, as I said, should be avoided. So, now, wild animal bites by wild animal, like severe bite. You get like a tiger, lion, leopard, this all come to this canine animal bite, foxes, jackals, mongoose. Whatever be the severity, this exposure falls in category 3, whatever is the severity. Observation of the animal is not called for. Definitely, you cannot observe. Bird hits are extremely less. So basically, it doesn't require any rabies vaccine for that. And I have come across with the cases where they are saying a bite from a mouse can lead to rabies or not. The answer is no. Never this rat bites can cause rabies. So again, management, what happens in India, wound treatment is only 39%. Vaccine taken is only 47%. Somebody takes 3 doses, that is only 30%, and 5 doses only 42.7%. RIG received is only 2.1%. Just think. Local application of the wound, yes, it is only 36. So definitely in India, the management of this rabies animal bite is not adequate and definitely not acceptable on any ground. So choosing the rabies vaccine, how will we choose? So WHO recommends the vaccine. WHO criteria of anti-rabies vaccines, antigenic potency should be there. There should be a good antibody titer. Then should be freeze-dried or lyophilized. DNA content should be below 10 nanogram. The volume of the reconstitution vaccine should be small. The vaccines should be well tolerated, safe, and having a high efficacy. So these are the why we choose the vaccine, but generally it is already there and will be kept. We just need to reconstitute and infiltrate. So pre-exposure, as I said, 3 dose, 0, 7, 21 or 28. Post-exposure, pre-exposure, just imagine your dog handler or घर पे if there is a pet, when you want, when patient comes to you, so they want to make sure that rabies doesn't happen even if there is a rabies animal bite. So pre-exposure goes with 0, the 3 dose, 0, 7 and 21 or 28. Post-exposure prophylaxis, as I said, 0, 3, 7, 14, 28. Re-exposure prophylaxis after there is a full vaccination. Again, there is a bite, as I said, day 0 and day 3. Okay. Passive immunization. RIG is indicated as per WHO recommendation in all category 3 exposure. According to the WHO, grade 3 bite is defined as a single multiple transdermal bite. Contamination of mucous membrane with saliva, we already discussed. Okay. The dose we discussed, equine rabies and human rabies, anti-rabies immunoglobulin. Now, this HRIG is the most recommended and the most widely, this is the most recommended, most potent vaccine. The problem with HRIG is it's very costly. Even imagine if there is a 60 kg individual having a dog suspected rabies dog bite. The cost of the treatment will go to around 30,000 for that. In contrast of that, Equina anti-rabies immunoglobulin they have got. Equina is an equine derived vaccine, and the cost is very much affordable. There are few incidents where they have come across with some side effects. So generally, we give a skin test before we administer this immunoglobulin. And after administration of this immunoglobulin, we keep the patient for under observation for at least half an hour or 1 hour, and then we generally release the patient because the high chance of hypersensitivity in ERIG. But HRIG, since the potency of the vaccine is very high, we have not come across with any kind of major side effects. So, so all category 3 bite, including the dose of pregnant woman and lactating mother, that has to be taken as a same treatment. Bites by all wild animal like mongoose, jackal, fox should be treated as rabies animal bite. Even category 2 bite, as I said, for immunocompromised or immunosuppressive patients should be taken as category 3 bite. So this is Equirab highly purified vaccine, not much to our importance. Berirap P is HRIG, which is there in the market, and the dose, as I said, HRIG dose is at 20 international unit per kg. Sorry, this is a vaccine which immunoglobulin for intramuscular administration. So this is HRIG 20 international unit per kg. So again, why it is necessary? Vaccine alone results in treatment failure. We discuss vaccine alone offers active immunization, not passive immunization. So category 3 bite, immunoglobulin is must. Vaccine offers protection only after 10 to 14 days. So, and we find an incubation up to 3 days. So it is very important that we have to understand only vaccine is not enough for category 3 bite. Immunoglobulin is the treatment of choice and that should be given. So again, Berirap HRIG contains immunoglobulin from donors and immunized with rabies vaccine. Donors are carefully selected. They're showing the potency of the virus. The potency of every production batch is confirmed by ability to neutralize rabies cell. So advantage, the element of purity, minimal or no foreign protein, no change in there is no chance of immediate hypersensitivity. There's a negligible side effects, and shelf life is for 36 months. So WHO recommends passive immunization with injection HRIG and active immunization by rabies vaccine for the management of the rabies exposure. So again, the same thing here. Category 2 immunocompromised, we discussed. Category 3 vaccination by a vaccinated pet also it is should be given, as we discussed. No skin sensitivity as a required prior treatment for HRIG. These are the benefit, and these are mostly company oriented. So here it is, the summary. Rabies is 100% fatal, yet fully preventable. India accounts for 1/3 of the world rabies death. WHO recommends RIG plus vaccine for category 3 bite. Berirap P or an HRIG is trusted over more than 2 decades and has been used in post-exposure prophylaxis for more than 1 million patients worldwide. So HRIG is convenient to use and it is well tolerated. Thank you. Fine, Satish sir. I cannot hear you.
Are you able to hear me?
Yeah, Satish sir, tell me.
Yeah, one question I have, like we commonly encounter patients coming with pet dogs, pet dog bites. They're with the complete vaccination status of their dog, with the file.
Yes.
Just like our file, they will have a file. So they'll get a file and show the vaccinations. If it is like category 1, how we need to proceed? Like if it is a category 1 or category 2 or
It's
category.
something that we actually, since we are one of the rabies center, we know this is a very common thing. Sir, the thing is, first of all, they come with a vaccine which they get for a self-satisfaction that my dog is vaccinated and I will not be getting rabies because of the whether it's whatever category is there. But sir, even if there is a vaccine, imagine I'm a veterinarian, a dog comes to me. It can happen that the vaccine which I'm giving to the dog, it might not, the cold chain is not maintained. So the potency of the vaccine is not have infiltrated. As per me, I've signed the vaccine has been given, but the antibody has not been developed adequately. Number one. Number two, it can happen the vaccine which has been provided was infiltrated, was not adequate to the dog. Third thing, it has I have not given the vaccine and I've just done a signature. It can happen, right?
Yes, yes.
So all these three things can happen. So in that case, the only way to find out, to take the blood of the dog and find out what is the rabies antibody present. So which is practically not possible for us. So what we do is we recommend at the same what WHO says, and if they refuse, we take a signature and a consent. But we explain that, this is what it is. It's an end disease. You never know. It's a vaccine. It is what disease is happening. But definitely, it is very common that every one of us, every second person has a pet dog at home, and every pet dog definitely licks, scratches, bites, does everything. So generally, if the patient relative is very much sure that fine, I know my dog is not rabic, it is their call. But for us, we don't know the dog, we don't know the patient relative, we go for it. My house cut dog comes and licks me every day. I will not go and take vaccine every day, but because I am confident my dog is not rabic. But if I go and ask a specialist, even know what to do, my dog has bitten to me. Specialists will never come and tell me you don't take, nothing will happen. It is my call. So I think the consent to be taken and then it can be left, but for recommendation is the same.
So you mean to say we have to give both the active and passive vaccination, like vaccine and the immunoglobulins both, even though the dog is vaccinated?
No, sir. Yeah. If there's a category 3 bite, RIG plus vaccine. If there's a category 2 bite, only vaccine.
Okay.
The recommendation is same.
So recently in July, there was a news like in UP, one kabaddi player.
Yeah. That's what.
He rescued a puppy from a drain and
Sir,
later
what
he died of rabies.
believe, sir, because what happens when there is a dog bite, generally they go to the local physician. and local physician chamber may they just write vaccine and they give. So vaccine is always, you have to understand, it will not give you a present immunity. It is for your future bites.
Yes.
People happily to take vaccine and they stay at home. Okay, so definitely this education level is for the community also, for the people and even for the local practitioner who can, like we need to make them understand that fine, this rabies, how this people, even a young and healthy patient can even die within 7 days of having a rabies dog, like, or a,
Yeah, it is very common. Like we going when we see the puppies, we go near to them.
it's very common.
It-
So
it's very
that's what mostly the puppies, even unknown puppies, when they're licking inside the mucus, they're licking your lip, they're licking your tongue.
Yes.
There's nowhere you can infiltrate immunoglobulin also.
Yes.
It is that dangerous. And you never know. Most of the night we generally ignore also. These are the reported case which is there in the slice or that we have found out. So many unreported deaths and unreported cases are there we don't even know. So people are not even aware. Even in places like the cities, they're not aware of taking immunoglobulin and vaccine. Any other question we have? Anybody else wants to have any question? It's a very important and interesting topic, basically.
So whenever we come across any unprovoked bite, we assume it is like a rabbit dog. And
Yeah, rabic bite. Any unprovoked bite is definitely rabic bite.
okay.
So you have to take it as every bite has to be taken as a rabic bite. And there was one more. Do we have any question? So there were many cases in which I found a dog has been bitten by a dog has bitten a cattle, maybe a cow, and they're drinking cow's milk. So whether rabies uh, will actually they'll get infected with the rabies. So chances definitely it's no. Big time it's no because the mechanism totally different. And generally this rabies exposure is mostly those animals who stays with these dogs and cats. The cat generally they don't bite. Cat they scratch. Dog bite. So dog can bite a sheep. Dog can bite a cow. Dog can even monkey bite. It has been reported few cases with rabies. So it's always better to understand any wild and any stray animal bite should not take risk.
Do bats like
Yeah,
people going into caves, those kind of people who do like expeditions,
yeah,
adventures?
yeah, yeah. Yeah. There have been cases reported with rabies with dog, bat. I mean, the bat also.
Okay. Yeah, that's
Fine.
for now.
Limited people, no attendees.
Yeah, there's no attendees today.
No problem. We'll keep this program on and definitely we'll get people interested.
Yes, 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 yes.
Okay. Chalo, Satish sir, thank you
Yeah,
so much.
thank you, Dr. Raj. It was really very detailed and it was very good presentation,
Thank you so much.
good insights.
Thank
Thanks for your time.
you. Sir.